7:22. Welcome back. Well, the holiday season is upon us, and it's a great time. A lot of us get together with our family, with our parents, our grandparents. They're aging, and it's good to check on them and see how they're doing. But a viewer wanted to know, how do you know when it's time to consider added care, not just leaving them on their own? To answer this question, we brought in our nurse practitioner, Dr. Stephanie Gray, to talk to us about it.
Well, our population is definitely aging, and by 2050 it's estimated there will be 90 million Americans over the age of 65, and there's wide diversity in health and function among those older adults. Interestingly, a lot of my patients have asked me that same question as they're taking care of their parents.
Yeah.
And moving a loved one into a residential care facility may be one of the most difficult decisions ever made, so a lot of things should be taken into consideration with that decision.
And how can we tell that they can't live by themselves? Because obviously, like you said, it's a very sensitive subject to broach, but how can we visually tell?
Well, safety first. So I would definitely say, think about home safety issues. So is this individual safe in their own home? Have you seen any accidents, close calls, or falls? Can they make it to the kitchen and to the bathroom? And in the kitchen, is there expired food? Are they able to prepare meals for themselves? Think about if they have any chronic health conditions that may make it more difficult, like dementia, heart failure, or respiratory issues. And even think about their appearance. So if your father or a family member used to wear a nice pressed collared shirt, and now suddenly they're wearing a stained t-shirt, that may be a cue into the fact that they can't take care of themselves anymore. Think about aggressive behavior. That's definitely a change, and that may be also associated with some dementia. So if there are memory issues, if their wallet or keys are getting lost, or if the stove is being left on, that might be another hint into the need for a memory evaluation.
Now, and there's a difference too. We're talking about caregivers, but then we also mentioned assisted living. When can you tell when it's time for one or the other?
I think that needs to be decided on a case-to-case basis.
Okay.
And I would ask the individual as well. Some individuals really want to remain in their home, while others may not feel well emotionally in their own home. They may have anxieties about being alone, and they might actually want to be in a facility with other individuals. They can socialize.
And when it comes to having a caregiver, I mean, that can't be an easy job. That's got to take a toll on the person that steps up, whether they're a professional or not.
Absolutely. So you really need to ask yourself if this individual's care needs are beyond your physical abilities. So do you feel emotionally or chronically tired or drained? I tell patients in a facility they have 3 shifts of workers working 24/7 to do the job you're trying to do for your loved one alone. So you want to acknowledge your limitations and not burn out. So think about all the above and really on a case-to-case basis, then decide when that decision need to be made.
Yeah, and maybe not take it as so emotional and just try and make it based off of life. And when it comes to older individuals like this, they obviously need medical care throughout their lifetime periods. And then I hear that you told us that there's a shortage of primary care available.
Yeah, many individuals are not aware that by 2025, it's estimated we'll have a shortage of 50 to 100,000 physicians. And essentially what that means is we're not going to have enough doctors to take care of the patients. And so as a nurse practitioner, I believe strongly that nurse practitioners can help fill that need. So 20,000 new nurse practitioner students graduated last year. There are over 220,000 nurse practitioners in the United States, 3,700 in Iowa. And so we believe we can provide that solution to the primary care shortage, and we can certainly help take care of the elderly. There are even adult and geriatric nurse practitioners like myself that are happy and willing to help when it comes time, if and when it comes time to make that decision for a family member.
So, and that's kind of like, I don't think anyone would think about a nurse practitioner to step into that position. Yeah. So that is a super useful. If someone wanted to go that route, how would they go about reaching out to one?
So pretty much every organization in town does have nurse practitioners that work for them. You can certainly visit the Iowa Nurse Practitioner Society website or American Academy of Nurse Practitioner website and find a nurse practitioner in your area.
Okay, awesome. Thank you so much, Dr. Gray. We appreciate you being here. If you want to take that look at this information again, we will have it on our website shortly. And if you have any questions for Dr. Gray, please send us our way. She's going to answer all of them in a timely fashion when we get her on the show. It is now 7:26, and coming up, we're going to take a look